Hi everyone, I am Beatrice. In today's video, we'll wrap up our respiratory medications. So today we'll be looking at anti-inflammatory. Don't forget to check my previous videos on over-the-counter respiratory medications and on bronchodilators. So if you are ready for today's video, let's dive in. Now for anti-inflammatory respiratory medications, we'll be looking at two classes. We'll be looking at the corticosteroids and we'll be looking at leukotriene modifiers. First, corticosteroids. So these corticosteroids, they are available as oral, IV and inhaled. But our focus will be on the inhaled. So that's the nasal steroids. Now for the mode of action of this steroid is to inhibit those inflammatory mediators, those inflammatory chemicals. And the essence is to suppress that airway inflammation. So once it's able to inhibit those inflammatory chemicals, it suppresses the airway inflammation and all those swelling around the airways are decreased. Steroids are also used systemically. Systemic steroids are used for systemic inflammation, but our focus here, because it's inhaled steroids, we're looking at the airway, so those swelling and congestion in the airway. When the inflammation is taken care of, those swellings and those edema, everything will calm down. Now, one thing you need to know about steroids is that it's not for acute attack. Some examples of inhaled steroids we have include fluticasone, budesonide, beclomethasone. Now let's look at the side effect of steroids. Generally, steroids can suppress the immune system and put patients at risk of infection, especially those systemic steroids. But our focus here is those steroids that are acting locally, so those inhaled steroids. So it can cause oral candidiasis, oral thrush in the mouth. It can cause sore throat, it can cause headache. And then for systemic steroids, patients are at risk of hyperglycemia and also osteoporosis, cataract, especially when it's used on a long term. Now, teaching, I mentioned patients should not use steroids as a rescue medication. So when a patient is having that acute attack, they should not take steroids. Another thing you need to know about steroids is that if it is prescribed with a bronchodilator, like beta-2 agonist, for example, you should use that beta-2 agonist first. Wait 5 minutes before you use your steroid. Also, we teach them to rinse their mouth after using a steroid, an inhaled steroid, to reduce the risk of that oral candidiasis. When they rinse their mouth, they should spit out the water. They shouldn't swallow it back. And also, we also encourage them to use it with a spacer to also reduce that risk of fungal infection. Now, for systemic steroid, we teach patients to take it early in the morning to mimic the natural body cortisol, so which usually peak early in the morning. And we teach patients also not to stop systemic steroid abruptly to prevent the risk of adrenal crisis. Now, the next class of anti-inflammatory we'll be looking at is the leukotriene modifiers or leukotriene receptor antagonists. Now, for the mode of action of leukotriene modifiers is to block the action of leukotriene. So it's an antagonist. It blocks the action of leukotriene. Leukotriene are inflammatory mediators that are released, especially when there's an allergy situation. So when the patient is exposed to an allergy, leukotriene is one of the chemicals that is released. So when it blocks that activity, it's able to decrease airway inflammation, decrease those mucus secretion, decrease edema, it decreases those bronchoconstriction. Examples of leukotriene modifiers include Montelukast and zafirlukast. Now for the side effects, the common side effects that could be seen with leukotriene modifiers include headache and GI upset. Now if patient is taking zafirlukast, the patient is at risk of increased liver enzyme, so elevated liver enzyme. So they should monitor the liver enzyme closely. Now teaching, we should also teach patients that leukotriene modifiers is not for acute attack. It's for maintenance, for prevention of allergy or prevention of those attacks, but it's not for when the patient is having the attack at that moment. Now, finally, we need to teach the patient if they are on Montelukast, they should take it in the evening or maybe a few hours before exercise, because it's also used for those exercise-induced asthma to prevent it. And for zafirlukast, they should take it on empty stomach because food can decrease the absorption of zafirlukast. So that wraps up today's topic on anti-inflammatory. If you find this video useful, please like, share, leave your comment and subscribe for more educational videos. Thanks for watching.